Donate online at alimdad.com or call 0861 786 243 for more information.
Are you feeling stressed, tired, or simply not your best? Find your balance to discover your wellness. Join us at the IMA Baitul Noor Family Wellness Weekend, the 9th and 10th of August, from 10 a.m. to 8 p.m. at the NMJ Hall. Free health screenings, educational talks, giveaways, food galore, kiddies activities. Entry only 10 Rand. IMA Baitul Noor. Our caring changes lives. For more information, call 031 209 7838.
Powered by Radio Ansaar.
Radio Ansaar.
Medical Files is brought to you by Busamed Gateway Private Hospital. Experience premium care with a personal touch.
At Busamed Gateway Private Hospital, we're redefining healthcare, combining world-class technology with compassionate personal care. From advanced robotic surgery with the only Da Vinci XI system in KZN to cutting-edge cancer treatment with the Hypersight radiotherapy machine. These combined with the experience of our leading specialists, you know your health is in expert hands. Busamed Gateway Private Hospital. Experience premium care with a personal touch.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
أحب الوفي الأمين أغر فأهل الوفاء أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, it is show us your choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. We welcome you to Medical Files, brought to you by the Islamic Medical Association of South Africa and empowered by Busamed. My name is Faizal MJ Suleman. Assalamu alaikum wa rahmatullahi wa barakatuh. We welcome our listeners on Radio Ansaar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion is liver function and liver diseases, and our very special guest this evening is Dr. YUSYF MOOLLA, a gastroenterologist practicing at the Busamed Hospital in Umhlanga. Dr. YUSYF MOOLLA, assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair for joining me on the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh to your Faizal and to the listeners. Once again, thanks for the opportunity to discuss the medical diseases this evening.
No, it's an absolute pleasure hosting you, Dr. MOOLLA. Now, Dr. YUSYF MOOLLA obtained his medical degree from the University of Pretoria in 2007. He then completed his internship at King Edward Hospital in 2009 before completing his community service in emergency medicine and pediatrics at the Stanger Hospital in 2010. After earning his master's degree in medicine and fellowship in internal medicine in 2015, he went on to specialize in HIV management, geriatric medicine, and then gastroenterology at the College of Medicine, South Africa between 2016 and 2019. During this time, Dr. MOOLLA served as junior consultant in the Department of Internal Medicine at Addington Hospital and later became senior registrar in gastroenterology at the Nkosi Albert Luthuli Hospital. He has published articles in the South African Medical Journal, South African Journal of Oncology, Southern Africa Family Practice, South African Gastroenterology Review, HIV Nursing Matters, and recently in an international journal, Liver Communications. He has presented research and talks at local and national conferences. As a specialist physician and gastroenterologist, Dr. MOOLLA specializes in the treatment of all common general diseases. However, he has an interest in the disorders of the digestive system, pancreas, and liver. He has a keen interest in inflammatory bowel disease, irritable bowel syndrome, and liver disease. In addition, Dr. MOOLLA is able to perform diagnostic and therapeutic endoscopy and endoscopic ultrasonic procedures. Dr. MOOLLA currently practices at the Gateway Center for Respiratory and Gastrointestinal Disease at Gateway Hospital and at Life Mount Eskom Hospital, and is a member of the South African Gastroenterology Society and College of Physicians, South Africa. I was about to say we really take an ad break. Anyway, Dr. Yusufullah, let's just start our discussion by starting off with what is the function of the liver?
Ji. No, and we appreciate medical science choosing the liver as a topic. It's often a topic that is not discussed frequently, and it's nice to focus on this organ. So it's a good question to start off with discussing the function of the liver. The liver is a large organ that sits in the upper right corner of our abdomen. We cannot normally feel it. It's tucked under our ribs. The function it does is amazing. You know, alhamdulillah, in our body, from our cells and our immune cells to our eyes, every organ and every single cell plays a role. The liver has specific functions. It actually stores some of our sugars, and that is broken down when we need it to provide glucose in our bloodstream. It helps to process fats. It helps to digest foods. It produces bile, which actually assists in these processes. It also makes protein, which helps to provide us with clotting factors, which help us to actually not bleed. It helps to process many medication, and it removes toxins and poisons to a degree from our body. So it does play a vital role in our body.
Mm-hmm. Now, what systems may one feel with liver disease? If one's suffering from liver disease, what sort of symptoms?
100%. So with the liver, it's one of those organs that if there is a occult problem or a very mild early disease can often be asymptomatic in presentation. So that is something important to take note of. We can give many examples going further. However, if diseases are acute or diseases are causing more long-standing problems, patients may have a yellow tinge in the eyes, which we term jaundice. Patients may feel very tired, have abdominal pain. One can have non-specific symptoms of fatigue. The urine can change color, become very dark yellow, or stools can become very pale. And in some of the acute scenarios, there can even be temperature, headache, itchiness, and even joint pain. So, I would say specific things would be symptoms of yellowness of color of the eyes and the skin, but a lot of non-specific symptoms and often asymptomatic.
So how prevalent are liver disease?
It's a good question. So in terms of the prevalence, actually, it's just coincidental. On the 28th of July was World Hepatitis Day, 28th of July, which is just coincidental. And that more focus is now given towards some of the liver diseases, especially viral hepatitis. And that's something that is unfortunately more burdened by third world countries, even the subcontinent, sub-Saharan African countries. So viral hepatitis is quite prevalent. In the more Western countries now, the diseases that they're seeing, it's not so much viral hepatitis, but we see a lot of metabolic diseases. And we also would see unfortunate alcoholic liver disease, which is more of a toxin-related problem. That's in the Western countries.
Mm-hmm. And what tests may suggest that one has liver disease?
Yes, so often, as I said, patients are asymptomatic and they would either get tests done for another problem or just routine tests done by the general practitioner or nurse or family practitioner. And often a normal blood panel, there's a one test called a liver function test. And the markers on the liver function test include some of our proteins, certain enzymes which go up with inflammation of the liver, and certain markers that go up with bile congestion. So incidentally, a liver function test on the blood panel may be abnormal. As I said, markers of congestion of the bile or inflammation or jaundice. There are many other tests which patients, doctors may order. Some of them involve more detailed tests, and some may be even imaging testing, like an ultrasound. So imaging testing, certain blood tests, that's often how some of the liver abnormalities are initially picked up.
And what causes these liver diseases?
So there's a long list of liver diseases. And in terms of the causes, as I said, one overviewing arcing term is hepatitis. But if you look into hepatitis, it means liver inflammation. We have different types of hepatitis. And of course, as I mentioned, it's hepatitis, World Hepatitis Day. So the common one would be viral hepatitis. The second one in the Western world, and becoming slowly more prevalent in our setting as well, is metabolic associated liver disease, or what they should call before non-alcoholic fatty liver disease. So that's a steatotic liver disease that's often in the metabolic realm. We often get toxin-related liver disease like alcohol liver disease. There is such a thing as autoimmune liver disease as well. And there are other varying rare entities, which include certain things like hemochromatosis, where there is an iron storage problem, and even a copper storage problem with a disease called Wilson's disease. And the list goes on. There are many other liver diseases that one can ascribe to.
Now, you did mention that there are various types of hepatitis, and you've been speaking of viral hepatitis. But what's hepatitis A, B, C?
Yes, G. So each one has its own niche. If I had to speak of the hepatitis A virus, for example, so this virus is spread with water, is spread with food. Unfortunately, it's passed out in the feces of infected patients. So where there's poor sanitation, there's poor sewage disposal, contaminated water and food, this virus is often spread in that scenario. So it's often a virus that we would see in travelers, we would see in poor areas where there's poor sanitation. That's viral hepatitis A. You also get hepatitis B, which is one of the now more chronic hepatitises, and this is now spread with sexual fluid and with blood. So this is often spread with sharing of needles, with drug users. It can be spread from mother to child. Unfortunately, hepatitis C also exists. This is also a blood spread, sort of mother to child spread, and also spread with sexual fluid as well. And there's hepatitis D and E that also exists. So you got A, B, C, D, and E. Those are the viral hepatitis spectrum. There are other viruses that can also cause inflammation of the liver, and it does get more complicated when we speak of those specific viruses. That's viral hepatitis.
And are these conditions reversible? Is there a cure for it? What's the prognosis like?
Yeah, that's an excellent question. So viral hepatitis A is often self-limiting. So it's often presents as an acute illness, as I mentioned, with food, with sanitation problems. Patients would feel very ill. Once one becomes infected, symptoms may come within 2 weeks thereafter. It's often with contact. And following this incubation period, patients may present with a flu-like illness, with general body pain, with headache, with myalgia, muscle pain, feeling sick, feeling nauseous. They may become jaundice. And the good news is that viral hepatitis A often is self-limiting. Patients feel very tired, very ill, their liver functions become abnormal, but it's self-limiting, so it sort of settles by itself. Very rarely can it put someone into liver failure. That's hepatitis A. Hepatitis B, the body does, the immune system mostly of the time would sort it out. However, unfortunately, this one can become chronic. And as I said, it's spread from mother to child, it's spread from person to person, from various different ways, but it can become chronic. In the acute setting, one can also feel ill, and it settles down, and then it lies as a chronic infection. And if no one is checking for it, unfortunately, it can be asymptomatic. And once it becomes chronic, it can slowly be damaging the liver, chipping away at the liver, causing some inflammation of the liver. And ultimately, once someone does blood tests, the general practitioner will find the liver function is abnormal, then do hepatitis B blood tests and find that's positive. And patients can either at that stage have already some chronic liver damage, some structural liver inflammation, some structural liver damage, and it's unfortunately one of the causes of liver cancer. And hepatitis C is similar. However, there is a difference with hepatitis C. Over the past 30 years now, for the last 10 years plus, we can actually cure hepatitis C with antiviral medication. Hepatitis B requires chronic treatment to manage it. At this stage, we cannot exactly cure hepatitis B.
You can't cure it, you can manage it, but is it life-threatening?
It is life-threatening if unmanaged, and even if managed, one has to still continue surveillance to ensure that liver cancer isn't slowly creeping there, or liver cirrhosis, which is scarring and damage of the liver, isn't also settling in. So one has to manage hepatitis B. Hepatitis C can be cured, but again, depending when it was diagnosed, if it's been sitting there for a long time, unfortunately, some patients can have liver cirrhosis, and that's one of the things we try to prevent by treating these illnesses is a sort of type of liver failure, and that's what liver cirrhosis means. The liver is actually failing due to scarring of the liver.
In fact, it's just coincidental that you mentioned liver cirrhosis. Somebody sent me a question.
Yes.
just asking, what is liver cirrhosis and what are the causes of it?
Okay,
Yeah.
so with liver cirrhosis, so that is an end result. So it's an end stage of liver inflammation most of the time. So whether the cause is chronic hepatitis B, whether it's chronic hepatitis C, whether it's inflammation from metabolic inflamed liver, fatty liver that's been inflamed for many years, whether it's due to toxins, for example, alcohol is a common one, as I said, internationally, all of the sequelae, all of the end results of these entities can lead to cirrhosis. So that is a failed liver, a damaged liver, liver that's dysfunctional. We do get stages to it. Early on, it may be. It now can lead to many different other problems, and that is cirrhosis. So there's a varying array of causes, all which is in a concept inflammation of the liver. And one analogy to think about is that if there's a slow brewing fire in a forest, for example, for a long time, now that has burnt out. And now we're dealing with, unfortunately, damaged areas. And that's exactly what happens. So one, if does a biopsy of a cirrhotic liver, takes a piece out of that liver, we see fibrosis, which is basically another word for scarring. And those areas become dysfunctional. They cannot function anymore.
The person says that the condition diagnosed was primary biliary cirrhosis. How serious is it?
Yes. So primary biliary cirrhosis is an inflammation disorder of the biliary tree. So in the liver, we have the liver cells, as I mentioned initially, and we have the bile ducts. And the bile ducts is where the bile is collected, the bile is formed, and then goes to our gallbladder. So if the bile ducts become inflamed, it's in an autoimmune way. One condition is primary biliary cirrhosis, or as they call it nowadays, primary biliary cholangitis. It's a condition that if diagnosed early on, there is treatment that can manage it. But as I mentioned, all these conditions, if they are long-standing, if they are not controlled early, if they are allowed to continue in a persistent state, the end result can unfortunately be cirrhosis, which is another word for permanent damage of the liver. But we do grade it, and it does get more technical. We do grade it. So it is a cause of liver cirrhosis 100%.
060-904-1056. Our WhatsApp number is 060-904-1056. We are discussing liver function and liver disease. Our special guest is Dr. YUSYF MOOLLA, a gastroenterologist. And if you have any questions, please forward them to us via WhatsApp on 060-904-1056. Dr. MOOLLA, you use the word liver failure, and you said it's cirrhosis is similar to liver failure. What, in layman's terms, is liver failure? And also, can that be addressed? Is there any cure for that?
Yes. So liver failure is liver cirrhosis in a different way, and it's in the same way. It's just a different terminology for it. So the liver becomes dysfunctional and is actually not working. So we would support it. And the first thing to do is, if there is a cause that's present, whether it's primary biliary cholangitis, or whether it's autoimmune hepatitis, or hepatitis B, hepatitis C, one would of course want to address that. So we would start treatment to address that primary problem, and also attend to the liver failure, as you put it. So each aspect of the liver failure will need to be attended to. So for example, if I had to use one example, the blood vessels that go into the liver, one of them is called the portal vein. So that vessel now, if it goes into a soft liver, it's fine. If it goes into a stiff liver, in simple terms, the pressure in that vein increases. And when the pressure in that vein increases, one can have veins in the esophagus or swallowing pipe that now starts to bulge. It's like a plumbing problem. Okay, so now it's diverting blood to a different area in high pressure, and those veins is one of the causes of morbidity, mortality, where somebody can end up in hospital with a bleed. So one aspect we'll have to address is to look at those veins and to actually put a scope in and try to rubber band those veins, to give certain medication to decrease the pressure in that veins. So that is a sequelae of a failing liver. Another problem would be patients becoming slightly tired and fatigued and weak, and even to a later stage becoming confused, because the liver cannot deal with toxins that are now sitting in the bowel, which normally it could deal to. And there we would give certain medication to try to keep that sort of waste product to a lower degree, to change the pH of the bowel, so the liver has less to deal with. So we would support the liver in that. One may have fluid around the abdomen purely because it's high pressure, and we have to give new medication to allow that fluid to become less. And that's a third thing that we would address. So each aspect that is related to the liver, from nutrition to muscle wasting, to fluid around the tummy, to the veins being big, each aspect needs to be addressed, and even one needs to screen for liver cancer, and that is also a complication of a failing, scarred liver, where in part of the regeneration process, unfortunately, liver cancer can be picked up. So each thing is followed up very strictly via guidelines, and each thing is managed.
You know, you mentioned something about rubber banding the veins. Is that a new procedure?
That's been done for a while. So the veins in the esophagus, veins can actually appear elsewhere in the stomach lining and elsewhere in the gut, but it's common in the esophagus. At that area, it's sort of an area where there's the highest pressure and it's most likely propensity for these veins to become large. We call it varices. There's two ways of dealing with it. Endoscopically with a scope. The one is to actually inject it with a type of a gluing agent that actually just closes it off. And the second way is to actually suck it up and to put a rubber band around it. We've been doing that for many years. That procedure has been around for over 20 years plus. And with that way, we try to allow those veins to get scarred and not bleed. So that is being done all the time. And most of the gastroenterologists will be doing a case every month, most likely.
And it is quite safe, and does it help in the long term?
Yeah, it does help in the long term. So we try to get those veins under control. If one cannot get it under control with the scope, there is procedures nowadays that can be done, which includes a shunting type of procedure where you divert the blood supply and the pressure. Ultimately, to solve liver failure, if somebody is in complete liver failure and is to, let's say, a more severe state, patients actually go for a liver transplant. So that will be the ultimate way of, let's say, healing chronic failed liver.
We'll take an ad break. We'll continue on the other side of this. To stay with us.
Radio Ansaar.
Medical Files is brought to you by Busamed Gateway Private Hospital. Experience premium care with a personal touch.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
حديث a day قال رسول الله صلى الله عليه وسلم اتق الله حيثما كنت. Fear Allah wherever you are. Taqwa means to fear Allah in every place or condition. Allah is observing us every moment of our existence. Taqwa is to fulfill every command of Allah and to protect oneself from His disobedience by not doing any sin.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
Are you looking for a meaningful way to fulfill your zakat obligation? Look no further than Ashraful Aid. With our trusted track record, your zakat reaches those who need it the most in the most honorable and dignified manner. Visit our website at www.ashrafulaid.org.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a Day. If someone arrives while one is eating, it is sunnah to invite him to join in the meal.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
Medical Files is brought to you by Busamed Gateway Private Hospital. Experience premium care with a personal touch.
Teaching you something new every day. Radio Ansaar.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Ansaar will be held responsible for any ill health caused by the advice given on Radio Ansaar.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and empowered by Busa Med. Our topic for discussion is liver function and liver disease, and our special guest this evening is Dr. YUSYF Mullah, a gastroenterologist. The number in the studio for your questions via WhatsApp is 060-904-1056. Now, Dr. Mullah, the question that came through is, my wife recently had a routine annual physical and was asymptomatic. Every test was normal besides her cholesterol being 5.7, but her gamma GT was slightly elevated at 72. Rest of the liver function test normal. Of course, she does not drink alcohol. What does the elevated isolated gamma GT signify? She is 65 years old, mildly hypertensive, on losartan and pre-diabetic and borderline diabetic on GTT, and taking metformin XR 500 for this.
Really, that's an excellent, excellent question. Jazakallah for that. Okay, so the gamma GT is on the panel of liver function test, and it can signify many different disorders. As I mentioned, certain tests will tell us about different aspects of the liver. It's more of an overview. So with an isolated gamma GT, with everything else being normal, it can come from many different things. In terms of the most likely scenario, so the right history that the brothers put there, that no alcohol history, so that is one cause of a high gamma GT, number one. Any biliary disease can also contribute to it. So even asymptomatic gallstones, a bit of gallbladder sludge, gallbladder disease could also contribute to it. Any bile duct type of problems, whether it is related to, for example, as you mentioned, primary biliary cirrhosis, or whether there is bile duct type of disease where there's an obstruction will cause it. But the number one disease that would actually cause this would be probably what we call fatty liver disease, or nowadays they call it steatotic liver disease. That will be the number one cause that will cause an isolated gamma GT if we just had to do a multiple choice. That will be the number one disease.
Mm-hmm, mm-hmm. Now, you spoke of fatty liver disease, non-alcoholic fatty liver disease. What is that? Can you expand on that?
Yeah. So when we speak of fatty liver disease, we speak of alcoholic, and then we speak of non-alcoholic. Nowadays, the terminology has changed to call it metabolic associated. That's the same thing as non-alcoholic. So this is actually the leading cause of liver disease in the US, for example. It's a disease that is part of the metabolic syndrome. So patients that are slightly overweight, patients that have diabetes or pre-diabetic, that have hypertension, these patients are at most likely risk of this disease. There is a genetic component as well, where different race groups may be more at risk or less at risk. And there is a significant lifestyle component. So, for example, with the urbanization that's happening and the change in our eating habits, patients are now having more processed foods. Patients are having more saturated fat in their meals, becoming more sedentary. All these factors, there's multiple factors that I just described, will contribute to this metabolic associated, let's call it fatty liver disease or steatotic liver disease. So that's the background of this condition, and that's the type of patient that will present to it. The next thing to ask is, well, why should we even worry about it? Why should we talk about it? The rationale for that is, yes, it is not incidental. It's not. It could be. It's of course asymptomatic, but it's not something that we should ignore completely, because a very small percent of patients can have inflammation of the liver that can now contribute to what you spoke about, long-term cirrhosis and liver cancer. But the risk is small with this type of condition as compared to other conditions, like I mentioned, hepatitis B, alcohol, and hepatitis C. So fatty liver disease is something that is very prevalent. In our country, we don't have so much of data to comment on how prevalent it is, how common it is, but we are seeing it more frequently. One test to do to probably screen the patient that you've described would be a basic ultrasound of the liver, because that will give us an overview of the gallbladder, that will talk about gallstones, and they can actually, in 90% of patients, detect fatty liver without doing a biopsy and without doing MRI scans of the liver.
Okay, a few questions have come in. The first one says, Assalamu alaikum, I'm 52 years old. I had my gallbladder removed 2 years ago. I notice pain in the liver, especially whenever I'm upset or eat unhealthy. What's good to do, especially if no gallbladder, to help liver cope? Jazakallah khair.
Yeah, that's a good question as well. So with the gallbladder removed, the surgeons would of course had indication to remove the gallbladder, and with not having a gallbladder, most patients, the bile that the gallbladder normally stores to aid in fatty digestion can be a bit disrupted initially, but the body does adapt to it, and some patients may have a bit of indigestion, a little bit of diarrhea, but with adaptation it normally settles and patients shouldn't have any problem. Gallbladder was removed a while back in this particular patient, so let's hope that it settles down further. If diarrhea is a problem, indigestion, there is medication that can be prescribed to assist. There are other causes, of course. So if it was a bit of a complicated surgery, there's what we call a post-cholecystectomy syndrome that can happen. There can be adhesions or scarring in that area, or there could be something else completely unrelated to the gallbladder region that's now giving pain there. But of course, the patient is making the assumption that it could be directly related to that. So of course, one should get that checked out to make sure there's no other confounding problem. And then we should be attended to conservatively, and hopefully it settles.
Salams, I want to be anonymous, had a CT scan done for something else. It showed a big cyst on my liver, but the doctor said it could be there for many years. Please comment.
So of course, that does depend on the fine print or what the pictures look like on the cyst. You get many different types of cysts that can be in the liver. Sometimes we see what we call hemangiomas, which is a bit of a blood type of collection type of cyst that is completely benign. You can see simple cysts on the liver, which again is completely benign. One can have multiple cysts on the liver. And then there are cysts that can be part of an infectious process, a parasite process, or something a bit more suspicious. So if the comment on the CT scan, the radiologist should comment to say this is a simple cyst, it's a benign cyst, and it sounds like that if the doctor says it's been there for a long time. For now, it sounds like it's not, there's no alarm features or no worrying features. But I think those sort of descriptions need to be confirmed before one can rest easy.
060-904-1056. We are discussing liver diseases and also liver function, and our special guest is Dr. YUSYF MOOLLA, a gastroenterologist. Now, Dr. MOOLLA, what steps can people take to protect their liver health and reduce the risk of liver disease?
Yeah, Gigi, excellent question. So as I mentioned, to follow up on the fatty liver or the non-alcoholic fatty liver, one of the takeaways from that, it's so prevalent nowadays in our lifestyle. So the general health advice, and of course what I'm saying for this condition is data driven. There's research that has proved that this has worked, alhamdulillah. It's just being healthy basically. So for example, if one has to look at the types of foods one shouldn't be consuming, for that liver problem, they found that increased sweetened beverages is a risk factor. They actually found that ultra-processed foods is a risk factor. They found that fast foods, saturated fatty foods is a risk factor. So our diet should involve foods that are basically healthy, number one. A diet that's favoring a Mediterranean diet for that specific condition was found to be helpful. But eating healthy foods definitely is a takeaway factor from the diet side. Secondly, for that condition, also exertion and exercise and getting the weight under control also proved to improve liver function. That comes to, again, being healthy. So doing exertional activities, aerobic activities, especially in combination of diet and aiming for good weight targets, getting the body mass index down, is actually healthy for the liver, but also helpful for many other aspects of our health, including cardiovascular. In terms of what we should put in our body, that's also very important. So certain, let's call it home remedies or certain anecdotal things that one would consume, certain extracts that we don't know what it does, I think we should be mindful and careful of what we ingest. So as we spoke about toxins, alcohol is the first thing that worldwide one will talk about. Unfortunately, there has been cases with many different over-the-counter medication that can harm the liver, from our analgesics to some of our herbal remedies. If it's taken without supervision, we have seen cases where the liver was affected. Thirdly, we should get our checkups done for liver health. Everybody earns hepatitis B, hepatitis C in the test in their lifetime, for example. Whether we're immunized or not, we should try to get that done. get a screen done of the liver. Other indicators that's actually been shown to be a bit more, let's say, pro-liver is actually having some coffee a day. So a cup of coffee or two has actually been shown to be helpful. And for the fatty liver disease, the literature is not firm on the guidelines, but if one look at studies, alhamdulillah, intermittent fasting is also shown to be helpful. And there was one study where they actually looked at fasting 2 days and not fasting for 5 days, and limiting the calories to a reasonable amount for those 5 days, which is basically our sunnat fast. And that intermittent fasting has been shown to actually help fatty liver disease. So eating healthily, watching what we're eating, exercising, avoid having unnecessary type of supplements, and general health. I mean, that's for now what I can advise.
Assalamu alaikum. Can HRT affect your liver? And which medication affect liver? Can fasting help you? Just answer that.
Jay.
What's the best time to eat breakfast for optimal liver function?
Okay, Jay. So the fasting one we answered. In terms of HRT, specifically for the liver hormone treatment, whether it's contraception or HRT, there is something called a hepatic adenoma, which is a type of a liver growth. There may be some implications with that. So generally speaking, all livers won't get screened before one starts HRT, but I think who's prescribing it has the sort of responsibility to discuss the side effects for it, and to possibly, you don't have to have an ultrasound everyone who starts HRT, but one should discuss the need for that in each individual type of patient.
Okay, it's time for us to visit the marketplace once again. We'll continue after the break, inshallah.
Radio Ansaar.
Medical Files is brought to you by Busa Med Gateway Private Hospital. Experience premium care with a personal touch.
Busamed Gateway Private Hospital is excited to announce that its kitchen and flame coffee shop are now proudly halal certified by the NIHT. Whether you're visiting a loved one or grabbing a quick coffee, enjoy a wide range of delicious meals. Our coffee shop is open until 8 p.m. for your convenience. Feel free to utilize our Musalla facility, which you will find on our first floor within the hospital. Busa Med Gateway Private Hospital, providing you with premium care with a personal touch.
There are over 200 million orphans globally. We can't help all of them, but what if we each helped just one? The Al Imdad Foundation now gives you an opportunity to help just one orphan from Syria or Palestine. For just 500 Rand per month, you can help safeguard the dignity of an orphan by assisting them with basic needs such as food, clothing, shelter, medical care, and attention. Our orphan sponsorship program allows you to track the progress of your orphan through regular feedback. Make a difference in the life of an orphan today. Visit alimdad.com or call 0861 786 243 for more information.
Come get our butcher's best for less at Checkers Foods Kawi Park. Enjoy certified halal butchery products like half lamb for just $99.99 per kg, chicken breast fillets just $59.99 per kilo, mutton danya or Punjab sausages for just $99.99 per kg, bulk lean beef mince just $109.99 per kilo, and beef poiki course for just $109.99 per kg. Deals valid until Sunday, August 3rd. Only at Checkers Foods Kawi Park. Now certified by the NIHT, the National Independent Halal Trust, across our butchery, bakery, and deli.
Butterlicious, butterlicious, butterlicious. When the food melts in my mouth, so does my heart. Blended by our expert chefs with pure cotton seed oil. Divine lasts longer, so cook more with Divine. Divine makes every meal a special treat. It is Butterlicious. Approved as part of the Heart and Stroke Foundation Eating Plan, Cotton Mark SA, and a proudly South African product. Divine Cooking Oil. Butterlicious.
Get ready to elevate your fitness game at First Fitness in Durban's Berea. With a spacious free weight area, award-winning equipment, and exclusive ladies-only parking and training level, we've got everything you need to crush your goals. Hit the ground running on our outdoor track or unleash your inner warrior in our MMA and boxing dungeon. Plus, enjoy high security and ample parking. And don't forget to refuel at our Halal Coffee and Health restaurant for the best in coffees, smoothies, and health healthy eats. Join us today and redefine your fitness journey. First Fitness, dare to be extraordinary.
Medical Files is brought to you by Busa Med Gateway Private Hospital. Experience premium care with a personal touch.
Audio stream across the world on radioalansar.co.za.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You listen to Medical Files, and our topic for discussion is liver function and liver disease, and our special guest, Dr. YUSYF MOOLLA, gastroenterologist. Dr. MOOLLA, question that's come through is, people drink green tea to lose weight. Antioxidants. Is too much green tea bad for the liver?
Gee, from the the herbal realm, homeopathic realm, I think one needs to see the actual ingredients. So often patients will say they're using a certain product. We try to analyze it as much as we can. Sometimes we even need to do research on what they're taking. I think with green tea in particular, if you use it in moderation, there hasn't been any red flags or alarm to say, well, one shouldn't have it in moderation. But again, you get so many different brands out there. You get so many different concoctions out there. I think we have to be careful again with what we're consuming and see exactly what's in there. Sometimes it may be infused with other ingredients and other extracts, and that's where there can be issues. If one is, I think, sticking to a certain type of therapy that is a bit alternative, one could do a simple liver test panel and probably do a kidney panel as well, just to make sure that this isn't causing harm. It's not common to see these alternative remedies cause problems. But again, because we see the referral cases, we have seen cases where patients have had problems from things that is over the counter, and you wouldn't actually think that is harmful.
And do supplements? They've named some supplements. I'm not going to name them, but do supplements work for good liver health?
So generally, again, we need to see what's in those supplements, and from our side, we would recommend what is evidence-based. And from an evidence-based realm, from supplements, there is some evidence, as I mentioned, if you look at specific components now in the realm, for example, coffee with the antioxidants that's found in that, omega-3 has been shown to be helpful for the liver. Vitamin E has been shown to be helpful with the liver. So those are particular, let's say, ingredients that one would recommend in moderation. The other sort of supplements which have this and other ingredients, again, one needs to see what's in it. Some of it, unfortunately, may not be backed with firm evidence.
Okay, this question I think we've just answered that question. It says, Salam's doctor and brother. Jazakallah khair for an amazing show. Taking, again, they refer to a supplement again. Help the liver, the supplements, and what's good to detox? It comes from a 65-year-old sister.
Yeah, so the word detoxification, it's often used, I think, unfortunately, more like, on the supplements at least, more like a marketing type of terminology, which is quite unfortunate because one gets the idea that if you take this, you're going to clean the liver in inverted commas and detoxify it. We wish it was so, and it was as simple as that. But what we discussed this evening with all the different modalities and lifestyle modalities is what we would recommend to detox the liver from what we're eating to the certain type of specific foods, so the certain types of diets, to exercise, to avoiding ultra-processed foods and sweetened beverages, to being healthy, to checking the liver function. Unfortunately, supplements-wise to detox doesn't really exist on our realm. But as I mentioned, certain products has been shown to be helpful, like the coffee, like we said, with the omega-3 and the vitamin E in metabolic disease of the liver. And that is, for now, I think where the evidence lies, with supplements at least.
Doctor, what is a colonoscopy, and is it a high-risk procedure?
Okay, so that's, of course, a little bit separate to the liver. So with the colonoscopy, that's a procedure that one looks into the colon, and that's done in a suite or in a sort of scope theater or mini theater. Patients are prepared the day before, and the next day they would come in and get a scope done. We would put a drip up and we would give them sedation. So they are put off to sleep. And with the colonoscopy, the view is to look into the colon, to screen the colon for anything like cancer or precancerous, what we call polyps or growths, or in certain patients to check for inflammation or ulcers, colitis, etc. It's generally regarded as a low risk procedure. So on the realm of procedures, I would say low risk. Unfortunately, not without any risk. The doctor performing it always has to take consent, and in a rare case has to explain what could potentially happen, which hopefully doesn't happen. And yeah, that's where informed consent is taken for all these procedures. But in conclusion, a low risk procedure, but not without any complications.
Doctor, is there any specific age group or demographic that should be more vigilant about liver health, and why?
Yeah. So, EJ, that's a good question. It does depend on, again, what demographics we're looking at. So, for example, as I said, the common condition of fatty liver, non-alcoholic. So, that demographic patients are often our diabetic, hypertensive, obese patients. So that is a demographic for that condition. And it can present now more early in life, and we're seeing that trend purely because of, as I mentioned, diet urbanization and fast foods being available. So it can start at an early age, and there even is now some data and some research in even pediatric age groups. So I think that is, of course, something that we should check on earlier on. In terms of the liver viruses, certain populations may be more high risk, so more of the poor socioeconomic areas. Unfortunately, some of these hepatitis viruses are more prevalent. In certain demographics, in certain areas, alcoholic liver disease may be more prevalent as well. So I think it depends on which liver disease in particular one is looking at. But I think for fatty liver disease, which is very prevalent, from a young age, it can present in that demographics of an obese, diabetic, hypertensive, sedentary type of individual. And as one gets older, one gets the checks up done, there isn't any criteria for screening right now in terms of specific age groups, unfortunately.
Thank you, doctor. And how can people with liver disease manage the condition and prevent further liver damage?
So I think it starts off with seeing your family practitioner, your general practitioner, because what we say stratify. So if somebody has a liver disease, whether it's the fatty liver disease or whether it's one of the other conditions we described this evening, the doctor will give that advice. And it does depend, even if one has these conditions, what grade or what degree the disease is. For example, Faizal, we have a patient that very recently ran comrades, and she is a very lean, thin female with chronic hepatitis B. But her disease is completely controlled. She has no cirrhosis. She's full lifestyle where she actually engaged in comrades. So, we stratify each patient. Normal lifestyle, patient comes for the checkups, we're checking up on her in a minimal scenario, but we're screening for liver cancer, we're screening for the viral load in that particular individual. But there may be another patient who has cirrhosis with varices, where one needs to keep an eye on very closely. So it does depend on that. And to answer that question, again, in conclusion, the doctor will advise each particular case is different.
Can fatty liver be reversed in a 50-year-old?
Yes, it can. So the evidence is with lifestyle being the first step. And it is determinant on doing the lifestyle change and achieving a weight loss goal if the patient is overweight. There is such a thing as somebody actually being normal weight, but that gets a bit complicated. So if somebody is overweight, we achieve a lifestyle a goal to get the lifestyle control, to get that weight under control. And there has been shown regression of the fatty liver. In a very inflamed liver, where lifestyle will not help you to achieve it, we have other means that now we can use, especially if they're diabetic, where we can use certain modalities and certain medication to assist to get that weight under control. And that has also been shown to assist with fatty liver disease. So we start with step number 1, and then some patients may need to progress to step number 2. And there is other steps below that. It depends on case per case.
Are there any other liver disease that we may that we need to be made aware of, or have you covered it all?
Yeah, so there's a very long list. So the long list.
I've got 3 minutes left.
Yeah, so just in conclusion, the younger patients who don't have any of the viral problems, we didn't talk about this. There is something called autoimmune hepatitis. So again, if somebody is feeling unwell and they see the general practitioner, I think for our listeners out there, maybe just ask for the liver panel test to get done, because that's a basic blood test on one tube. It's not that expensive. And if the liver looks inflamed, there may be autoimmune hepatitis, and that is something that presents in patients in the late teens to the early 20s for the first time, and that is an autoimmune disease of the liver, which is treatable, and if goes unnoticed, patients may be missed for years until finally they get a test done. So yeah, the answer for that is get checked out and ask them to do that liver panel test, and if the cause is uncertain, then of course be referred to a liver specialist, and then we will look at all the list of other causes, which again, from rare diseases to more common diseases, those diseases are out there and we need to think of them.
Dr. Yusuf Mullah, I want to thank you for joining in the program this evening, but you don't go away just like that. I'm sure you have a message for our listeners and some advice for their taking care of their liver.
No, Jazakallah again for the opportunity. So as I said, it was World Hepatitis Day on the 28th of July. And I think the talk show has definitely emphasized on liver disease this evening. We mustn't forget about that, because it can often be a silent disease. Only when it's really complicated do patients present. So we have to insist that our general practitioners check up on that liver when they're doing their annual checkup for other conditions, number one. Number two, for the most common condition, it still boils down to healthy lifestyle. That same lifestyle will manage our pre-diabetes and our hypertension and some of our cardiovascular disease. But with the liver, we also got evidence that just being healthy and watching what we're consuming, watching what we're taking and being active, it's what we all should be doing. And unfortunately, with the genetics out there, some patients need to work a little bit harder.
Once again, thank you very much for joining me in the program. You certainly shed lots of light and shed lots of information, and I'm sure that we're now going to be much more careful. To all the technicians in the various radio stations, thank you very much for having engineered this evening. And to all our listeners who tuned in, thank you for having tuned in, and thank you for all the questions that you posed. From myself, Faizal MJ Suleman, have a wonderful evening. Assalamu alaikum wa rahmatullahi wa barakatuh.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Ansaar will be held responsible for any ill health caused by the advice given on Radio Ansaar.
Medical Files is brought to you by Busa Med Gateway Private Hospital. Experience premium care with a personal touch.
Busamed Gateway Private Hospital is excited to announce that its kitchen and flame coffee shop are now proudly halal certified by the NIHT. Whether you're visiting a loved one or grabbing a quick coffee, enjoy a wide range of delicious meals. Our coffee shop is open until 8 p.m. for your convenience. Feel free to utilize our Musalla facility, which you will find on our first floor within the hospital. Busa Med Gateway Private Hospital, providing you with premium care with a personal touch.
Radio Al